I, Dr. Ramkumar Srivastava, will give you information about the HMPV, that is the Human Metapulmonary Virus. This virus, which is very commonly present globally and especially this is spreading in China, and nowadays this is also spreading in India also. 5 years after the COVID-19 pandemic, China is now grappling with a surge in cases of human metapneumovirus HMPV, a respiratory virus. Several media reports and social media posts suggest that the virus is spreading rapidly across the country. This is the microscopic structure of the HMPV. Reports indicate that the spike in HMPV cases has led to a notable increase in sudden deaths, particularly affecting individuals aged between 40 to 80 years. Data from Chinese CDC in late December 2024 revealed a fluctuating but increasing positive rate of HMPV cases among children aged 14 and below, according to Chinese state broadcaster CCTV. In 2023, HMPV cases were reported in the Netherlands, Britain, Finland, Australia, Canada, the US, and China. HMV can cause both upper and lower respiratory diseases in people of all ages, with young children, older adults, and those with weakened immune system being most vulnerable. China CDC addresses the human metapneumovirus HMPV outbreak, stating it typically causes common cold symptoms but can lead to severe respiratory conditions in vulnerable groups. No vaccine or effective treatment exists nowadays. Officials emphasize preparations and urge general precautions to avoid alarm. The human metapneumovirus HMPV is already in circulation globally, including in India, said the Health Ministry on Monday, January 6, 2025, while stating that none of the cases in India have any travel history and that all the infected persons are recovering well. The common symptoms is just like the cold, which include the cough, fever, nasal congestion, and shortness of breath. HMPV is spread through respiratory droplets, direct contact such as handshakes or touching contaminated objects. The virus has an incubation period of 3 to 5 days. So, the virus is only present for 3 to 5 days and then it will ultimately subside, just like the common cold. HMPV often causes common cold symptoms manifested as cough, fever, nasal congestion, and wheezing, but sometimes it can result in bronchitis and pneumonia in severe cases, said China's CDC. In susceptible individuals with underlying medical conditions such as the diabetes, hypertension, etc., HMPV infection can lead to death. Human metapneumovirus HMPV is a common virus that usually causes symptoms similar to a cold. If you are older than 5, you are probably already had it at least once. The common cold is a very common disease which is present in the individual, and most of the times you will get better at home in a few days by taking the symptomatic treatment. but sometimes HMPV can cause serious complications. Most HMPV infections only last about 2 to 5 days and go away on their own. Treatment consists of supportive care to ease symptoms such as taking the paracetamol, vitamin C, and anti-allergic drugs. Preventive measures include wearing mask, frequent hand washing, and boosting immunity. Expert cautions against the use of antiviral drugs to treat HMPV. In the HMPV, you should not use the antiviral drug. Currently, there is no vaccine or effective medication against HMPV, and treatment is mostly focused on alleviating symptoms. That is, only you have to take the paracetamol, vitamin C, and anti-allergic drug. So these are the symptomatic drugs which you can take for the relief of the symptoms. Thank you.